But we're only going to be doing subtle hints of just small amounts of small areas to just give her a little bit of enhancement. The main areas I told you that most women come into me talking about are their under eyes, their cheeks, and their lips. So that's what we're going to address today. We have a young, beautiful female. She just wants her lips to look naturally hydrated, a little more plump. I love that pink show of the lip. We want to do that. We also just want to make her look like she's always awake and happy and not feeling tired. So we're going to improve her under eyes with a little bit of filler. So what we're going to do, look up with your chin. I'm going to do one little needle poke. This is going to allow me to have an entrance site for my Restylane Refyne. You guys can see.
What kind of needle is that?
This is a cannula, not a needle, so it won't hurt anyone.
Now, why is a cannula better?
And a cannula is better because I can use one little entrance site, and I can just trick her into thinking that nothing went in there, and without any pain, I can literally just inject a little bit of filler. And again, like I said, in this area, you want to be a little more sensitive to overdoing fillers. You don't want it to look swollen. So I want to give her just a little bit of hydration. Turn to the left a little bit more.
Does this help with wrinkles?
This will not help as much with wrinkles as it will for hollowing and sort of contouring a little. We're using this to just into the trough area to just soften any darkness. Just doing a little, not a lot. Now with Refyne, this is a very fine filler, very soft, and the reason I like these is, I'm going to switch sides, is because it tends to move with you, it blends with the tissue really well, and it doesn't lump or bump. So we can get a nice, soft, natural look. She doesn't want to look overdone, she doesn't want to look like she's had anything done. She wants to trick everyone into thinking she's naturally beautiful, which she is, but now we're just enhancing it. And so we're using a little bit of the filler. You see I'm just going very soft amount into that under eye area. Just give a little lift and a little softening. Refyne's a softer filler. It can be used in many different areas. Here we're using it for the under eye, and I'm also going to use it to soften a little bit around her mouth because we're going to use Kysse, you guys, our newest filler for lips. But I'm also going to use the Refyne around her mouth because what this will do is blend the mouth. It'll help the lower lip. You guys will see in a second. Hold on, let's find a little entrance site there. Little pinch, this feels weird here, I'm sorry. This is the lower cutaneous lip or the chin lip junction. By putting a little bit of filler right here, this turns the lip down and also helps the chin. So it's going to make her look just softer, and now with the balancing of her under eye, she's gonna look even more balanced. This is not about overdoing fillers. This is about using them in the right way to shape. Oh, you have good skin. Can't find a little entrance site. There we go. So in this lower cutaneous lip, this hurts a little bit. I'm sorry, but she's totally strong. This is going to make her chin look more heart-shaped to the rest of her face. Blended. Perfect. So
Does it help with the wrinkles under the eye?
We just said that the fillers don't help with the wrinkles, you guys. It just helps with the hollowing.
What do you use for wrinkles under the eye?
So lasers, peels. Remember I was saying Emer's skin now has refit eye. Everyone is talking about it. They love the eye serum. It has bioactive growth factors and a hidden ingredient that you feel. It tightens the skin right away. So look at the eye now. Softer, more subtle. Look at the chin crease and the blending here. Now we do the fun part. We're going to use Kysse. So Kysse is one of the newest fillers for the lip, and it has a special technology that works with expression. So when you move your lips, you talk, you don't want the filler to lump. You don't want it to move around. We need it to stay where it wants to be. We want it to be soft and natural. So this is expression technology to allow us to create a shape that doesn't move. So we're going to do a little pinch at the top. I'm going to start with outlining the lip slightly. She has such a cute Cupid's bow. We'll go nice and slow.
Does the cannula have a risk of vascular occlusion?
Well, with any injection, there's always a risk of occlusion. but with cannula, it's less.
Doctor's so hot. Is he single?
Me or her?
The doctor.
Oh, the doctor's so hot? Thank you. Can't tell you guys all my secrets. So we're just creating a little outline here. And now I'm going to follow just right at the edge. I just want to give her subtle improvement. You guys are going to see with Kysse, it actually goes a very long way. You don't need a lot of the material to see a nice result.
Travis says she's beautiful.
She is.
And yes, he is married to his job.
Yeah, exactly. If you guys were paying attention, I was here at 6 in the morning today for surgery. And now I'm here doing one of my favorite things, facial sculpting. She's a trooper, you guys, I can tell you that, because this doesn't feel good. Okay, let's switch sides. I'll give you a second break. We'll get your eyes, don't worry, Rosa will get them. Just so you guys know, when you do lip filler, you tend to tear up, no matter if it's painful or not. I'm going to switch with you. Look up for a sec. Good. So with her, she has a beautiful Cupid's bow, and she has a little cleavage point in the middle of her lip. We don't want to get rid of that, so we're leaving that. And we're just subtly enhancing the base of her lip. Go ahead and close. I'll get your tears.
1 through 10, how bad does it hurt?
How bad does it hurt? 1 to 10.
3.
That's not bad. 3's not
I
bad.
just feel pressure. I don't really feel much.
Okay, well, you're doing great. So we're going to do a little defining.
Would you ever use fillers on the nose area?
Yeah, I do fillers all the time on the nose. Go ahead and close. All the time on the nose. There's a higher risk of issues with it, but if you know the risks, you still can do the treatment. You just have to go nice and slow. I'm going to do a little bit actually on the border here because she has a little bit of some down turning on the corner. I also want to get that improved slightly. Let's go back. Now we're going to take a look for a sec. Hold on. So now I'm going to define the border just a little bit.
Now tell us about the Cupid's bow. Why is that a very important area?
So Cupid's bow is extremely important because this is the lip show. This is one of the most obvious signs of beauty. Women's lips stand out the most when they're defined, specifically at the bow. So I'm trying to lower her lip just a little bit so we see more of the edge. You can see here, look. With Kysse, I'm able to really define the border and really project. You see this curve now. Let's go to the other side. This is looking good. And we don't want it to look overdone, but also I don't want her in a week after the swelling goes down. Close your eyes again. I'll get you. Say that she wishes she had a little bit more.
Brandon loves watching these.
Really? I want to know, what do you guys like? Tell me. I like the results. That's what I like. Okay. I like seeing patients happy.
Fillers help diminish crow's feet or chest Botox.
Dysport can be used on any of the toxins to help the crows and or lasers. So a little bit more.
What makes Restylane Kysse different than regular Restylane?
It's much
Specifically for the
softer.
lips.
It's specifically for the lips, and it has a different type of technology that works with the movement of your lip so that It's exactly the shape that you want. Plus, I'll tell you guys from years of experience, you feel Restylane, regular L, you don't feel Kysse in the lip. That's the difference.
Rodrigo Derma from Mexico. Hello.
Hey.
Oya says you're an artist.
Thank you. Well, I'm painting right now, guys. So don't bug me. No, I'm kidding. We're almost done. It's so nice. Okay, almost done.
I wish
Sorry,
you were in
I'm
NYC.
I keep making different decisions right now. because-
Someone said I wish you were in NYC.
Well, we'll be in New York, you guys, in a few weeks. I'll let you know the date very soon.
So how do I get an appointment with you? If I'm in New York.
Contact our office, DM your name, email, and phone, and we'll make your appointment as soon as we know the exact date. Okay, I just need one more on the other side. They're gonna kill me. I'm being a perfectionist, a crazy perfectionist right now.
Travis wants you to come to Minneapolis. I wish you were in Houston. Everyone's
Love my Texans.
so satisfying to watch. How often is Kysse filler expected to last?
All the fillers typically last you guys, the HA fillers tend to last about 9 to 12 months on average, but let me tell you, don't worry, no more crying. Close your eyes a sec. All my patients after 3 to 6 want a touch up. They always want a little bit more. Actually, it's usually a week, to be honest. All right, so right now they're a little swollen, but I love, oh my God.
Yeah.
Everything. So let me show the audience, and then I'll show you, okay? We softened the under eye and gave a little lift to the cheek. We brought the chin forward slightly and softened the crease, and then we increased the size, the pink show of the lip, reverted the upper lip, and gave her more of a cupid's bow. Remember, with lip filler, it swells and then it settles within 1 to 2 weeks. Let's do an Emer reveal.
Let's keep cleaning up, yeah.
I'm gonna keep cleaning off all the little injection points that I did. Emer reveal, you know what that is? It's when you see yourself on my phone and you tell me what you think. You hate it, you hit me and you're wrong. Okay? Otherwise, I hope you like it. Everyone
There you
seems
go.
to like it on Emer reveal.
I can bring it up close.
Oh, I have lips.
So,
Oh my
what do you
gosh.
think?
It's great. I mean, I have lips.
So look up a little bit. Yeah, there you go.
And I don't even have makeup on.
No makeup. What do you think of the under eyes?
I think it's
Softer.
very natural, yeah.
Smile as big as you can, because the most important thing about the under eyes, you don't want to have too much of a line here.
Yeah.
And then the
That's
other thing
good.
is, I softened the chin area. I don't know if you can tell. If you turn your head to the
Definitely.
side,
No, we don't have
much
that
more
thing.
balanced.
Yeah.
But look, go up close. Look at the lip. What do you think of those?
I don't have makeup on. It looks like I do. I really like it.
It's so great. So now,
Wow.
I'm going to show you in the mirror, because it
It's so
always looks a
natural.
little bit different without the phone. Take a look.
Holy crap, it looks really good. I waited way too long to do that.
I know. So what do you like the most?
That it looks like my lips still, but just a better version of me.
Yeah.
And I know it's swollen, but like,
It'll settle in too. I always find that, especially when we do border injections, that there's always a little ridge and then it settles. But now we have a cupid's bow. We have a little more volume centralized. We kept the cleavage point and we gave you more of a pink show.
I like that you kept this though. Like,
Yeah,
I have
the
the dip
cleavage.
there.
Yeah.
Yeah.
That's what I call
Because when
it.
people lose that, I just feel like it gets floppy.
And it looks unnatural.
Yeah.
So we want to keep everything natural. So that's another successful female facial sculpting with feature enhancement, lip, under eye, and a little bit
I
of
love this.
chin. I know the crease
What
makes
did
a
you
big
do?
difference.
Yeah.
The little filler to the lower cutaneous lip lifts the corners here, so it makes it look like you have a smile all the time. And also balances the chin, because as we age, you guys, this area starts to curl in, and then it drops the lip, and it doesn't look as good. So now it makes the overall face look better. And that's what we did. Subtle feature enhancements. I love it. Have a good night.
But my side profile looks really good.
Oh, I know, that's what I'm saying.